Hey guys, so this is Chapter 1, EMS Systems. At the beginning of every single lecture, there is going to be a couple of slides that tell you what standard competency this particular PowerPoint will be covering. This one is preparatory, so giving you a basic knowledge of EMS systems. And then kind of going into that much further. These can be thought of as the objectives as well. We'll go into research and then public health as well. Just as far as an introduction to the class, this textbook will be your primary resource. There are several other textbooks. This is not the end all to be all on EMT education, but this is what we'll use for this course. EMS overall is a system. It's not being an EMT specifically or a paramedic. EMS is emergency medical services as a whole. So just kind of keep that in mind as well. An EMS system is a team of healthcare professionals. They provide emergency care and transport. There's a couple of different ways that we're governed, but the ones that affect us the most tends to be the state laws. When you complete the course, as long as you complete everything successfully, you will be able to sit for the certification exam. The slide does say state, but in the state of South Dakota, we actually use the National Registry test as the certifying exam for initial certification. There's a couple different parts to that we'll go into. Once you complete the entirety of the test and pass it, then you can apply for licensure within the state. Most states follow the outline that has been set forth by the National Registry of EMTs. The most basic level is the EMR. The next level up is the EMT. Going through more training, having more skills, then we'll put you at the advanced EMT or AEMT level. And then the top level is the paramedic. An EMR or emergency medical responder has very basic training. So the layperson typically takes a CPR first aid class. This is one step above that. They typically arrive on the scene and provide care before an ambulance arrives. They can assist in the back of the ambulance, but they cannot be the primary attendant in the back of an ambulance. The EMT, which is what you're participating in, is trained in basic life support, so BLS. You learn CPR, the use of an AED, an automated external defibrillator, airway adjuncts, assistance with medication, patient assessment, etc. The AEMT does all of the BLS, but then does advanced life support as well, but just a little bit of it. They don't fully delve into it like the paramedic does. So this will include some IV therapy, so initiating an IV and maintaining an IV, and then starting to administer emergency medications. Paramedic is that top level of pre-hospital care. You get extensive advanced life support training, endotracheal intubation, which you see on the screen there. Is the proper name for us putting a tube down your throat so that we can control your airway and breathe for you. There's a whole plethora of medications that we can give, cardiac monitoring, EKG interpretation, and then the use of a manual defibrillator instead of the automated one. So in order for you to be successful in this class, there's a couple of things that you need to do. One, you need to read the book. If that means taking notes, if that means just reading it, if that means highlighting, whatever it is that you need to do, make sure that you are actively reading the book. You're going to need to view all of the lectures and participate in discussions. These are mostly going to be in the form of blog posts on your Student Weebly site, but we'll have some other assignments as well. There are step-by-step demonstrations. There'll be videos on the Weebly site, as well as you'll get to go through demonstrations on how to pass all of those psychomotor stations when we have lab day. There's skill sheets. There's going to be some case presentations and some scenarios where you guys actually get to apply your knowledge. It won't be on a real patient, but this will kind of help you figure out how to put it all together. There are assignments as well as quizzes on the JBL site that you'll need to complete as well. As far as the overall system, EMTs are definitely one of the most important providers, especially here in the state of South Dakota. Having ALS services is not really feasible. Most of our services throughout the state are BLS services, meaning that they are run pretty much predominantly by EMTs. The time and energy that it takes to get your EMT licensure is much easier, much more efficient than going through that advanced medical training. And we have a pretty vast state with not a whole lot of large hospitals, really. And so it often falls on EMTs to respond to emergencies and transport patients all over the state to get the care that they need. Some of the subjects that we'll end up covering in this course is going to deal with keeping yourself safe, figuring out what's going on with the patient through a couple of different forms of patient assessment, treating appropriately, packaging, which is just our way of saying getting the patient ready for transport, and then what you can do with EMS as a career. EMS is a great stepping stone to any sort of medical career that you want to have. In order to be an EMT, there are certain licensure requirements that you have to meet. They do differ from state to state, but the general requirements set forth by the National Registry are that you have to have a high school diploma or equivalent, so a GED. Now you're participating in this course in your high school career, so you will be allowed to take the test, but you won't get your results or be granted your licensure until you actually graduate. You have to have proof of immunization against some communicable diseases, both for your protection and for the protection of your patients. And then you have to have a valid driver's license. In order to gain licensure, you have to have a current CPR card, which we will take care of as part of this course. You have to go through a state-approved EMT course, and this one is. And then there's two portions to the exam. So there's the cognitive portion, which is an actual computer adaptive test that you'll schedule after the completion of the course. The practical exam, also known as the psychomotor exam, is where you go through skills stations and are tested. And we will take that at the end of this class as your final exam. You have to be able to meet the mental and physical needs and demands of the job. This is a rough job. The demands put on your body, the demands put on your mental psyche are rough. Not everybody can do this job. So making sure that you can take care of yourself both mentally and physically is very, very important. And then your state, local, the employer that you'll end up working for, they all have additional provisions that you'll have to meet, but they're not mandated federally. It generally comes up, well, what about those with disabilities? We cannot, in this profession, discriminate against somebody because of a disability. However, there are performance standards that must be met in order for somebody to safely complete this job. If you are physically and mentally able, but do have a disability, provisions can be made for someone to participate in EMS as a career. History of EMS. We are a relatively new healthcare profession, and I use the term profession very loosely because EMTs, paramedics are not considered professionals. We're considered allied health. But it originally started with World War I and having volunteer ambulances to transport patients off the battlefield. And then the actual let's take care of patients in the field kind of picked up around World War II. When we hit the Korean conflict, then air medical transport actually started, and rapid helicopter evacuation, which is actually called medevac, really started to pick up. And then that all transitioned into the civilian side. It seems with EMS, it all kind of originates with the military side and then transitions over to the civilian side. The EMS system ideal that we kind of know today started with a publication back in 1966 called Accidental Death and Disability, the Neglected Disease of Modern Society. And that kind of helped shape what EMS really needed to focus on. Overall, EMTs or EMS didn't really take hold in the US until like the early 1960s. As far as training, the Department of Transportation ended up publishing the first EMT training curriculum in the 1970s, and it was pretty darn basic. So much has changed since then. It is absolutely insane. The American Academy of Orthopedic Surgeons are the one that created the first EMT textbook, often referred to as the Orange Book. And then the book that we'll be using for the class is just a later edition of that book, so 10th edition. And then several different entities have been coming together over the last 10, 20 years to try and standardize the levels of EMS education. They're kind of taking it one level at a time, focusing on advanced life support and then working their way down the hierarchy. So in 2013, it was mandated that to become a paramedic, you have to go through an accredited program, and there's specific accreditation standards that those programs have to meet. We're working on right now the advanced EMT level. There's no mandate for accreditation at this time, but they are kind of leaning toward that, and then they'll continue down. Right now, there is no accreditation process for EMTs, but there are a couple of continuing education accreditors that do keep track of the EMS education for EMTs. So the different levels of training that say you have to be trained to this level. The federal level provides the national EMS scope of practice. It's kind of the overall guideline for EMS skills, what knowledge you should have in order to be a successful ambulance attendant, and then what skills you definitely need in order to adequately care for patients at the BLS level. State level, there's laws that regulate EMS provider operations within the state. Our state is not very strict with EMS laws. They do a lot of refer to federal guidelines overall. And then at the local level, so the service that you work for has to have medical oversight from a medical director. So a doctor has to oversee every single ambulance service throughout the state. And they kind of focus on the day-to-day limits. They focus on quality assurance, making sure that patients are taken care of properly, making sure that there's operating procedures for that specific ambulance service. Here's the hierarchy and how they interact with each other. So the national level, the state level, and medical direction definitely all intertwined. They're not separate entities. Below the EMT, EMR level, there are what we call lay people that are trained in basic life support and CPR. Mostly anybody that works with children must be certified. So teachers and support staff within the school, coaches, all childcare providers, in order to gain licensure, must have a CPR trained staff. We also have a lot of national initiatives that are putting AEDs within public spaces to include schools, which is something that we didn't have that long ago. And there's a lot more focus on teaching hands-only CPR and basic first aid to just the general public. Other emergency medical responders, law enforcement officers, firefighters, park rangers, ski patrollers, basically anybody that has a basic medical knowledge that is provided above that layperson level in order to assist EMTs or initiate care prior to EMS arriving. Good Samaritans. These are people that are trained in first aid and CPR. They often either show up at a scene or witness the incident, and they can provide valuable assistance, and they are protected by law. They don't have true formal medical training. It's pretty basic, and they can be a great asset in taking care of patients. However, they often get a little overzealous not having that formal medical training, and they can get in the way and make things much more difficult than they need to be. That's one of the aspects that we need to learn about to be an EMT is scene control and making sure that things are getting done for the good of the patient, and that can be very difficult sometimes. For training for EMTs, the course is approximately 150 hours overall. You learn knowledge and skills for basic emergency care, and the EMT is the lowest level that can be a solo attendant in the back of an ambulance. AEMTs, we've already talked kind of about what their additional skill set is, as well as paramedics. Paramedic has the most extensive training, 800 to 1,500 hours or more. And then one of the standards for accreditation is that anybody that goes through paramedic training, that program has to have a way to offer them college credit, be it associated with a degree, associates or bachelor's, or just a matriculation agreement with a college, so that those hours will apply toward a degree. A couple of different components of the EMS system. There's a document called the EMS Agenda for the Future, and it really outlines the 14 components of an EMS system. And they actually just published a new EMS Agenda for the Future. This is a very long, wordy document, but it kind of talks about here's where we are now and here's where we want to go in the future as a profession. So the different components: public access, communication systems, clinical care, human resources, medical direction, legislation and regulation, integration of health services, evaluation, information systems, system finance, education systems, prevention, public education, and finally EMS research. And we'll go into each of these individually. Here's kind of the overall look at how they intertwine with each other. Public access means that anybody should be able to call for emergency services anywhere. So this is where we created the 911 dispatch system, so that there's one unified number for someone to call in order to get help. The emergency medical dispatch, or EMD system, now provide callers with instructions. They have scripts that help work through CPR, that help work through bleeding control, so that care can be provided well before the ambulance arrives. Communication systems. So from caller information, the dispatcher then determines who needs to respond to the call and how they need to respond to the call. EMS, it may be fire department, maybe the police department, maybe independent ambulances, either public or private ambulance services. And now we have technology that help different responders locate patients. So cell phones is a big one. All of them pretty much now are GPS integrated, and if you dial 911, it kicks on that module so that the dispatchers can see where you're at if need be. Clinical care, this is pieces of equipment and scopes of practice for that equipment, so who can use it and how do they use it. This familiarizes EMTs with ambulance controls in their PSA, or primary service area. Human resources focus on the people who actually deliver the care, so compensation, interactions with other members of medical community, well-being and taking care of yourself. There are efforts to help it be easier for a paramedic or EMT in one state to transition to another state. It's called the compact, and there's a couple of states that have adopted it yet, but there's a huge push to make it really easy to move from state to state. A lot of states will do what they call granting reciprocity. So if you're a EMT in the state of South Dakota and you move to Minnesota, rather than having to take a certifying exam again, they verify your credentials and then allow you certification or licensure within their state. Medical direction, like I said earlier, every single ambulance service has to have a medical director that oversees operations, and they determine what appropriate care is in the form of standing orders and protocols. So rather than have to call the doctor for every little thing, they do have a set of protocols that say, if you find this, you may do this without needing to contact medical direction. Medical control can be either offline or online. So offline is indirect. So standing orders, training, supervision, protocols. So you're not actually talking to the medical director voice to voice. Typically, it's not going to be face to face. They've already set up certain guidelines for you to conduct patient care without needing to contact them. Online or direct medical control, you're actually talking to a physician either on the phone or over the radio, and they're giving you direct patient care instructions. Legislation and regulation. Each EMS system kind of has their own set of regulations that they have to follow, be it from their medical director, or from state legislation or federal legislation. Typically, each service is going to have an EMS official that kind of oversees. Typically, we call them the director, service director. They're very similar to a police chief or a fire chief. They're not in charge of the medical matters. That is definitely left to your med director, but they go through everything else that's needed to keep a service running. Integration of health services, pre-hospital care that we provide out in the field needs to be coordinated with the care that's going to be administered by the hospital. So we do radio reports, we do handoff reports in order to make sure that that patient gets the best care possible. So what we begin in the field should just be a continuation once we get to the hospital. Evaluation, your medical director oversees all of the quality control. What we typically do in order to do that is we do chart audits. We go through and read what happened on various different calls, especially if there was a problem on that call, to make sure that protocols and standing orders were followed. Then there's training and continuing education that you are required to do every 2 years in order to maintain your licensure. And the overall goal is to minimize errors and improve patient outcomes. Your information system is what we use to document care. Everything used to be pen and paper. It's not anymore. Everyone had to shift to an electronic PCR, patient care report system, a few years ago. Everything is stored electronically, so it can be easily reviewed and used to improve care overall. Some of the things that we really look at is on-scene time for trauma patients. The faster that they get to a hospital, the better their outcomes tend to be, because there's not a whole lot we can do for true trauma patients in the field. You can look at errors that are made in the treatment of a certain population of patients, be it stroke patients, heart attack patients, etc., and determine the need for more education. And you can also look at national trends. We know that when the seasons change, there tends to be a spike in COPD exacerbations just because of the changes in the air quality. So it definitely helps you be able to treat patients more effectively. System finance, obviously you have to have money to keep a service running. The types of EMS services are here in this table. Private organizations tend to be the most common, or fire-based departments. We do have a private service here in Sioux Falls. Patient Care EMS is our private service. However, all of our fire departments do have ALS providers on their engines, and we are getting a transport service with an ambulance at one of the fire stations for mutual aid and assistance. As far as who are EMTs, some of them may be paid, some might be volunteer, or a mix. There's partial paid services where they have some full-time staffing, and then they fill the rest of the roster with volunteers. Education systems. EMS instructors are licensed in most states. We do have an instructor society here within the state of South Dakota that EMS instructors are required to go through. Any sort of ALS training can be provided through colleges or adult career centers, also the hospital setting. And then continuing education is needed every 2 years to keep up the certification. So there's certain requirements that you'll be able to see on the National Registry website. From the time that you get certified until the next expiration date, you have certain modules or areas that you have to complete in order to keep your licensure. Prevention and public education are huge focuses within the EMS system. If you can prevent an injury, that's certainly better than having to go and treat it. So that's definitely something that we as EMS educators try to focus on, is community education. We work with several public health agencies on prevention. Primary prevention focuses on strategies that will prevent the event from ever happening. And then secondary prevention occurs after an event has already happened, and then you strategize on how to prevent it from happening again. EMS research. EMS research is extremely important. How we used to determine how to treat patients were, hey, this just sounds reasonable, so let's do this. And there was really no research behind best practices in order to help patients. So slowly and surely, we started paying more and more attention to how we were implementing care and then tying that to patient outcomes, and figured out very quickly that some of the stuff that we were doing made absolutely no sense. Research definitely helps determine the impact of EMS on the community. How we participate in research is by thoroughly documenting and accurately documenting patient care. Truthfully, we learn more retrospectively than we do through kind of research studies like you would typically think of them. Roles and responsibilities of the EMT. Whether they're paid or whether they're volunteer, EMTs are considered healthcare professionals. So there are certain roles and responsibilities that you have to do. This is kind of a big list of what you should do, and then we'll go further into that throughout the course. First and foremost is keeping your vehicles and equipment ready for an emergency. Restocking, doing rig checks to make sure that you have everything that you need is essential. Ensuring safety for yourself, partner, patient, and bystanders. If you get hurt, you can't help anybody else. If your partner gets hurt, now you're taking care of your partner and your patient. So safety is extremely important. Operating an emergency vehicle, being an on-scene leader, taking control of that scene, performing an evaluation of the scene so that you know that you're safe, your partner is safe, and your patient is as safe as possible. And then knowing from that scene what could have potentially happened and what injuries you can expect from your patient. If you need to call for additional resources, some things are just too hard to handle with the 2, maybe 3 people that you get with an ambulance crew, and sometimes it's necessary to call in more reinforcements. Gaining patient access, so how to get to that actual patient. Performing a patient assessment, giving emergency medical care to your patient, awaiting the arrival of additional medical resources if you have called. Only move patients when absolutely necessary to preserve life. Give emotional support to the patient, family, and other responders. Maintain continuity of care by working with other medical professionals. Resolve emergency incidences. Uphold medical and legal standards. Ensure to protect patient privacy. That's sometimes very hard to do in the field, but that's definitely something that we want to do for our patients. Give administrative support. Constantly continue professional development. This is an ever-evolving field, and you'll have to know that you need to learn all the time in order to keep up with current trends. This is not a career path where you're going to learn everything up front and it's not going to change. You're going to learn everything through this EMT class and then constantly be learning. Every patient that you come in contact with is going to be a learning opportunity for you. You need to cultivate and sustain community relations and then give back to the profession. Professional attributes, things that we look for in EMTs. Integrity is very important. It's acting consistently and maintaining a firm adherence to a code of honest behavior. Empathy is being aware of and thoughtful towards the needs of others. Empathy and sympathy are very, very different. Sympathy is seeing what somebody is going through and kind of understanding it. Empathy is feeling what others are going through. Self-motivation. So this is discovering problems and solving them without somebody directing you. Even as an EMT, which we think is the basic provider, if there's only 2 EMTs on that service or on that ambulance, you guys have to be able to figure it out for yourselves. We work highly independently compared to other medical professions. We don't have physician orders that we have to follow. We don't have to wait for orders a lot of time because it's all pre-made. Appearance and hygiene. Think if you had gotten sick or injured and somebody showed up to take care of you. Would you want the guy on the left that looks pretty put together, very confident? Or would you want the guy on the right who looks pretty darn sloppy, has open-toed shoes, a hat on? There's no way. What we need to do as professionals is that we need to project a sense of trust, professionalism, knowledge, and compassion towards our patients. We have to gain our patients' trust, and often we're with them for such a short amount of time that first impression may be the only opportunity that you have. Self-confidence, knowing what you know and knowing what you don't know and being able to ask for help. Oftentimes in this profession, we have to be really good actors. It's not that you know what's going on 100% of the time and that you know exactly what you need to do for your patient, but you still have to be confident in yourself and your ability to assess a patient and know when things are outside of your limitations and you need help. Time management, so this is performing or delegating multiple tasks while ensuring efficiency and safety. There's a lot going on our scenes, and it's up to us to figure out how to most effectively and efficiently take care of our patients. Communication skills, huge. Understanding others, making yourself understood to others. In this new day and age of being able to text appropriately, but not being able to have a face-to-face conversation, that will not work in this profession. You have to be able to clearly and concisely talk to your patients, not only to gain more information about what is going on with them, to be able to treat them, but also for yourself, being able to communicate in writing what was going on with that patient. Teamwork and diplomacy, this is working with others, knowing your place within a team, communicating while giving respect to the other person that you're communicating with. We all work in a team. There's no way that we can do this job as an individual. It's just not possible. Respect, placing others in high regard or importance and understanding that they are more important than you. Your patients are more important than you, except when it comes to safety. Your personal safety is number one. Other than that, you need to put the needs of your patient above your own. Patient advocacy, it's constantly keeping the needs of the patient at the center of care. Careful delivery of care, paying attention to details, making sure that what's being done for the patient is done as safely as possible. And then every patient is entitled to compassion, respect, and the best care, regardless of their situation. It's not ours to judge them. It's not ours to say that they don't deserve the best. Every patient deserves the best care possible. As healthcare professionals, we're bound by patient confidentiality. So HIPAA, the Health Insurance Portability and Accountability Act, says that we only share information about our patients with those that need to know. So insurance is one that we can share information with, and then anybody that's going to be in the continuity of care of that patient need to know. Others do not. So this is not I'm going to go talk to my family and tell them all about this patient that I had. I'm not going to have any pieces of paper that I throw away in a public trash can so that somebody can identify this patient. You have to be very careful with the information that you have. There's a summary at the end of every single one of these lectures. I will not be going through the summary as part of the lecture. You have access to all of the slides on the JB Learning website, and it's a good idea for you to go through the summaries so that you kind of have a quick reference for what was covered. But other than that, that is on you. There's also some review post-lecture questions that you can go through, but I am not going to go through those. It's too hard to do in a recorded lecture. If you have questions about any of the lectures, please feel free to contact me. Put it in your blog so that your fellow students can answer. It's very probable that if you have a question, somebody else has that very same question. So that is chapter 1.